Hi, I'm Dr. Sivranji Santosh. I'm a pediatrician. We all know that Corona is here to stay for many more months, maybe more than a year, maybe a couple of years. Vaccine is likely to reach us maybe towards the end of this year or the beginning of 2021. It may turn out to be very effective or it may turn out to be not that effective. We'll have to wait and see. Meanwhile, what is corona doing to us? Initially, we thought it affects mainly the lungs. Later on, we realized that it affects the clotting system of the body and lead to severe complications including stroke. And now we came to know that it causes something called multi-system inflammatory syndrome in children. So around 3 to 4 weeks after the initial infection with coronavirus, children develop high fever and lot of changes happen in the body that will affect multiple organs of the child, including the blood vessels which supply the heart. These blood vessels are known as coronaries, and this kind of effect can lead to heart attack for the children right from a very young age. We are seeing that kind of thing happening. Something similar is happening with adults too. And also now, during the initial infection with corona itself, we are seeing some children, with some children, this corona is going and sitting in the blood vessels of the heart and affecting them. So this predisposes the child to heart attack from a very young age. Okay, so it's doing so many things to us. And with each day, the medical fraternity is learning more and more about it and learning about better methods to manage corona infection. So, the later we get the infection, the better. So, I urge all of you to be very serious about continuing with the precautions. Go about your daily work, but please take precautions. Be responsible and be sensible. This is very, very important. And you be responsible not only for your family but also for people around you. This is very, very important. Earlier, we thought that mortality, that is death, is more common only with old people and those with comorbidities. Now we are seeing so many young people succumbing to the illness. Even many doctors have lost their lives. Even children are developing severe complications, as I have elaborated just now. Though the severity of illness is less in children compared to adults. Among children, those with comorbidities, that is underlying medical conditions like heart disease, kidney disease, asthma, and those children who are younger than 1 year of age, these children are likely to develop severe illness. Okay, so we are learning a lot now about corona, and as I said, the later we get the infection, the better. Now, when it comes to the spread of corona, initially it was thought that the spread is maximally through fomites. But now, fomites means what? Like, suppose I have corona infection, I touch my nose, I I clear my secretions and immediately touch, say, a pizza box. I'm a pizza delivery boy. I touch it and I deliver it to you. You handle it and you again take your hand to your face. So you are carrying the virus from me to your face through the pizza box, right? This is known as fomite spread. Earlier it was thought that this causes the maximal spread, but now we know that maximal spread is through droplets. That is, I cough onto you, I sneeze onto you, then the spread is maximal. But still fomite spread does exist, and I urge all of you to continue with all the precautions to prevent coronavirus infection. Masks, hand hygiene, cough hygiene, very, very, very important. And do not keep touching your face, and physical distancing. Minimum 3 feet, but preferably 6 feet distance. And avoid being in closed spaces in groups. Okay, so this is also very, very important. Now let me look at the other points I would want to tell you. Yes, right. So now what's happening is, when one person suspects that he or she may have come in contact with a person with coronavirus infection, that is COVID-19, or if they suspect that they have symptoms, they are very confused about what to do. Should I call my doctor? Should I do a PCR, that is swab test, nose swab or throat swab test? Or should I do an antibody test? Or should I do a CT scan? So I'll try to make it as clear as possible. Okay, so if at all you suspect that you have symptoms of COVID-19, or you think you may have come in contact with a person with COVID-19, okay, what should you be doing? Okay, so symptoms you all must be aware: body pains, fever, cough, cold, sore throat, loss of sense of taste and smell, headache, vomiting, diarrhea, rashes. Okay, then when do you think that you may have come in contact? If you have spent 15 minutes or more within 6 feet distance with a person who is suspected to have COVID or proven to have COVID-19, or if you have spent time in a closed space or in a bus or a car with a person who later in the next couple of days to 3 to 4 days turns out to be COVID positive. Okay, or if you are staying in a place where community spread is rampant and you have the slightest of symptoms, please suspect COVID-19 and do the necessary. Okay, so why did I say that, if you have traveled with a person and in the next couple of days to 3 to 4 days if he had developed symptoms? Why? Why? Because if I develop symptoms today, or I turn COVID positive today, then the chance of me spreading coronavirus to you is maximal starting from 2 days prior to me become symptomatic or testing positive, to around a week after I become symptomatic or test positive. So that's why if you traveled with me today and I develop symptoms 2 to 3 days later or test positive 2 to 3 days later, then you become a primary contact for me. Okay, so you will have to get yourself tested. So when do I do the test and what do I do? Do I need to contact my physician? Ideally, you should contact your physician. Okay, if you don't want to in the initial stage because you do not have symptoms, you only have a suspicion, yes, you are supposed to give the swab test. Antibody test is not diagnostic. Okay, the nose swab or throat swab as per what the lab is doing. Okay, so how do I give the test? Do they come home? Yes, some of the labs are sending their people home. They wear the personal protective equipment and come home. And if you are going to the lab, you have to make sure you don't become a risk for others, because you may already be in a stage where you are likely to spread the infection to others. We don't know as of now. Okay, so what to do now, right? So please, throughout your way, make sure that you maintain 6 feet distance from others and wear a good surgical, well-fitting surgical mask or N95 mask without an exhalation valve, and follow all hand hygiene, cough hygiene precautions. Very important. If you are living in a gated community, inform the management so that they create a channel for your easy movement without affecting the others. Right? Till here, am I clear? So, if you suspect you have COVID 19 symptoms or you have come in contact with someone with COVID 19, this is what you have to do as a first step for yourself, and also make sure you don't get others into trouble. This is very, very important. Now, two things can happen. What can happen? You can develop symptoms and your test may come positive. Your test may come positive, but you won't be having symptoms, or your test may come negative. Right? Three things may happen, sorry. So, if your test comes positive, okay, but you don't develop any symptoms, still you will have to isolate yourself for 10 days. Isolate means really isolate. Okay, in another room properly. There should not be, you should really maintain a good physical distance from others. Wear your mask. If by some chance you'll have to come in contact with them, a very good mask. But ideally, please isolate yourself completely. Okay, this is very, very important. Suppose you develop symptoms. Okay, you will have to definitely now contact your physician. Okay, because COVID can, start with a mild viral kind of fever. Okay, but in the second week, it can create havoc with your immune system and create lot of damage in your body. It can damage the lungs, it can damage the blood clotting system, it can damage the heart, kidney, blood vessels of the heart. So you should be with a good physician, right? And what about isolation? Isolation here is at least 17 days as per ICMR, and at least 3 days of symptom free period. So suppose I have symptoms for 5 days, still I will complete my isolation period of 17 days. But suppose I have symptoms for 16 days, then my isolation period will be 19 days, because at least 3 days I should be symptom free. Understood? No? 17 days or at least 3 days of symptom free period, whichever is later. So asymptomatic or symptomatic COVID positive, I've told you what to do. Now if your test comes negative, but you strongly suspect that you may be having COVID, okay, you may have come in contact with a COVID patient, what do? You should compulsorily complete your 14-day quarantine period. Quarantine means you are a contact, you don't have symptoms, you have come COVID negative, but still you need to quarantine yourself for 14 days. You should not, maintain all these rules of physical distancing from others, not meeting them, not sharing things. Basically like isolation only, but you are not a patient, you are only a contact for 14 days, because COVID test can come negative in 40% of cases. Once you complete your 14-day quarantine period, you are free. But in the interim period, if you develop symptoms, then again you should contact your physician, and the physician may ask you to test for COVID again. He or she may ask you to do a CT scan. He may ask you to do some blood tests to diagnose COVID as well as to assess the severity and to decide about home care or hospitalization. Okay, so just because you test COVID negative, don't relax. 14-day quarantine is a must, and in the interim period, if you develop symptoms, you should again contact your physician and do the needful. Same with COVID positive patients who are symptomatic. the physician may ask certain other tests, CT scan and blood test, to see, to look for the possibility of you developing severe illness and to guide you accordingly. So this is also very, very important. Then what to do about people you may have come in contact with before you develop symptoms, or before you have developed symptoms, or before you have tested positive. So I have already explained to you, the peak infection is from 2 days prior to the onset of symptoms or being tested positive to 1 week afterwards, right? So if you had, you should contact all the people you may have met starting from 2 to 3 days prior to you testing positive or becoming symptomatic. Please contact them and inform them that you have become positive for COVID or you are having COVID symptoms, so that they get alerted and they themselves, observe 14-day quarantine, and they should give their COVID test between 5th and 10th day after the latest contact with you. Okay. And irrespective of the result, they should complete their quarantine period, and if they develop symptoms again, they have to contact their physician and do the needful. So I hope I am clear till here. Okay. So completion of the quarantine and isolation and reaching out to your potential contacts and guiding them, informing them, and reaching out to your physician and following up carefully is very, very important. Now, there are certain other things which I am seeing, going wrong with the way people are handling things. One is supplements. Okay. So if you are eating good food, a balanced diet, okay, you don't have to take supplements. So concentrate on eating a balanced diet rich in vitamin C and zinc and other nutrients. Okay. The only problem here is we are not getting enough sun exposure nowadays. So we may have a problem with vitamin D. So contact your physician and take the appropriate supplemental dose of vitamin D rather than self-medicating. Large doses of vitamin D can damage your kidneys, can build up the pressure in your brain, can cause stones to form, calcium stones to form in your kidneys. Large doses of vitamin C taken for a continuous period can cause stones in your kidneys. Okay. So even zinc, large doses can cause anemia. Eat good food. If you are able to spend some outdoor time without exposing yourself or the others to the risk of COVID, yes, please spend some time in the sun. Okay. Talk to your physician about the right dose for vitamin D supplementation. And if you develop COVID illness, then the physician would guide you and give you a temporary course for all these supplements. The other confusion is about checking oxygen levels. So I don't have any symptoms, anything. I don't have to really check my oxygen level every day, right? But what's happening is, in some adults, not in children, they have noticed something called happy hypoxia. What is this happy hypoxia? The person may be just doing fine and suddenly one fine day he feels very fatigued, and when you check the oxygen level, it is very low. So he didn't have any symptoms so far, but suddenly, acutely, he falls sick and oxygen is very low. So that's why oxygen levels are being monitored, especially in older people, even with the slightest doubt of COVID, like slightest cough or slightest fever, slightest symptom. From that day onwards, oxygen levels are being monitored with an instrument called pulse oximeter. So again, it is imperative to take the physician's guidance with regard to how to use it and how to monitor and when to reach out to the physician. Right? And the last point, sorry, I'll need to see if I have missed anything. Okay. Yeah, so I think that's it. To summarize, don't relax. The later we get COVID, the better. And we have no right to jeopardize other people's lives. So we will have to continue taking precautions properly, and we'll have to continue following quarantine rules and isolation rules properly. And it's always better not to self medicate. It's better to being in touch with the physician always. And if it is a child, be in touch with the pediatrician. I hope this talk of mine has cleared many doubts that may have been troubling you so far. And very, very important, don't relax on the precautions, please. The later, the better. Thank you.